So I did a video on goals of care and how it impacts and how we kind of really start thinking about goals of care in terms of our medical decision making, in terms of how it impacts our day-to-day activities. And I gave several types of day-to-day activities and just started to ask questions. And I also put it up on the screen so that you can see what the questions are and how you start to determine what's acceptable and what's not acceptable in terms of your day-to-day activities. And I mentioned one little aspect there that I want to delve in a little bit deeper and show you the trick that I used with a lot of, with some families and patients of my own when I was in hospice and palliative care. Hi, my name is Abigail. I am here to normalize these conversations and education about death and dying so we all die better at end of life. Let's get into the topic today. So today we're talking about, do your goals of care and your medical decisions align? And so again, in the first video that I talk about here, I gave several aspects of day-to-day kind of routine type of activities that we usually encounter at some point in our day-to-day, and asked, in each of those sections, each of those items, I gave, a few different type of questions, and I also posted them on the screen to be really specific so you can actually look at that, screenshot, whatever you need to do, so that you can determine what is acceptable and what is not acceptable to you, particularly when we're talking about end-of-life decision care making. So what I want to talk about now is once you've done that and once you've determined what is acceptable and unacceptable, the next step is to really determine, is what you're doing now, especially if you're making medical decisions, is what you're doing now for yourself or for your loved one, is that aligned with what you want and what you find acceptable? In the first video, it's important that you watch the first video on goals of care because I speak directly to day-to-day aspects of daily existence and care and living. And there are several types of items that I brought up. For example, it was mobility, communication, level of consciousness, things like that. And, certain things I want you to ask and to see what you determine as acceptable and unacceptable in terms of quality of life, particularly at end of life. So now that you have time to think about that, what I want you to do is grab a piece of paper and, nothing fancy at all. Grab a piece of paper. And this is something that I just started doing. And this was in the midst of a goals of care conversation with a loved one that I had who was making decisions on for their loved one. They were making medical decisions on their behalf and they were struggling with certain things. So we had the discussion and kind of had the discussion about what is day to day, these certain things that are really acceptable and unacceptable to you in terms of the direction of medical care. So now that we settled that, what I had them do is, and I've done this many times and it's been very helpful, but you take a piece of paper, draw a line in the middle. On the left side, I want you to write down, whether it's for you or your loved one, what does the ideal day, night look like for this person, including their desires, including their goals of care in that mix. What does that ideal day look like? And you don't have to do this all at once. I think the first time I did it, I said, I just want you tonight when you're sitting down, after your meal or during whatever it is, you're having your tea, whatever it is, or your drink, whatever works for you, sit down on that left-hand column. I want you to write, what does that ideal day look like for your loved one or for yourself? Start at when you first get up, whether that's getting it up at 6 o'clock in the morning or getting it up at 12 in the afternoon, whatever it is. Write that down. Getting it up at 12 in the afternoon. Being able to have my breakfast with coffee and pancakes and being able to eat those. And, I can make it. I don't have to make it, but I want to have my breakfast. And then I want to make sure that I can, go to the bathroom on my own, or I want to be able to go sit on the deck and read my book and be really, really specific. And when I say specific, I mean specific to the point of like when I'm going to the bathroom, I can wipe myself versus someone else wiping me, or am I okay with having somebody wipe me? Again, this comes from, we're pulling this information from that first video that we had where we talk about the day-to-day specifics. What are we okay with mobility, level of consciousness, all that kind of stuff. So taking that and kind of doing that first assessment, what does that perfect day look like? Being really specific in terms of not just doing stuff and talking on the phone, but actually doing things like, getting up out of bed. Can I empty my own trash? Can I cook my own dinner? Or am I okay with somebody cooking for me? Being really, really specific. And by the time I get to bed, what that looks like, the time, being able to watch a show, being able to turn the TV off by myself or not, or having somebody around to turn it off, whatever it is. Great. Be really specific. And I usually say I like having somebody just take one day and just do that. The next day I call this person up. And this is really how I like to. I like to do these separate columns on separate days. So they wrote that down. You write down what you want. And now, what I said, now I want you in that other column next to you. I want you to write down again, be really specific. What is happening right now with your loved one or with yourself? What's actually happening? And starting again at what does the beginning of the day look like? And go all the way through until, when you're going to bed or that person's going to bed, what does it look like? So what is it actually looking, getting to the nitty gritty? Well, so say it's like for your loved one, your mom who is in a nursing facility. Well, they come in at 7:00 in the morning, they turn on the lights and they, change my mom's brief. They hook her up to tube feeding and that's going through. And then they turn the TV on and they're, the volume is at whatever number. And then they keep her in the TV room for the next 2 or 3 hours. Then they come back around 11 o'clock and they move her out to for activities where maybe they're tossing the ball around, but is she participating or is she sitting there and she's not participating? What are these things looking like? And if she, goes to the bathroom, is she continent? Is she not continent? Does she need to be, brought into her bedroom by a caregiver? And does she have to be rolled, back and forth in the bed to be able to be cleaned and all that kind of stuff? Or can she actually do that herself? Be very specific. And again, if you need to go back to the other video and look at those specifics if you didn't do that exercise, but you must be really specific. So what you want to do once you have your paper with the 2 columns, on the left, you've got, what does the ideal day look like, for you or your loved one that you're making decisions for. And then on the right side, you have what is actually happening right now. And then what I want you to do is I want you to reconcile those 2 columns. And the best way that I did this before with people is just put lines, connect the lines as to where things are the same. And, you should have like at least several connections, I think. This is really, again, individual and up to you. Maybe what's only important to you is just maybe having one big thing. Maybe it's just really important for you to maintain your cognition. And that's the most important thing. Everything else can, be, having some type of assistance for all of your cooking, walking, whatever it may be, but maybe it's really important for you to cognitively connect with people. Who knows? So you have to determine what is really important for you, but look and see, when you reconcile those 2 columns, look and see, is what you want really happening with what's happening on the day-to-day, whether, again, that's just for you or your loved one. And it was so good to put that down on paper because especially for people who were struggling, I talk in one of my videos about dissonance, the dissonance that happens between our cognitive understanding of things and our heart, and how it's totally expected for you to understand and know that you have to do certain decisions, particularly at end of life, but your heart is like, I don't want to. This really helps, particularly for people who are struggling with their heart strings being pulled in a different direction from their brain. So, we may never get rid of that dissonance. It's just a reality. Our emotional bodies are going to be emotional. Our heart is going to feel sad and have grief and anxiety about losing a loved one. That is normal. You may never get rid of that, and that's totally okay. But cognitively, you may have a full understanding of what's important and how to best honor your loved one with their wishes and desires that they have already, hopefully, that you've already talked to them about. And you know that you need to make certain decisions, even though it might mean that they may die sooner because, you're not dealing with these completely futile curative treatments that, sometimes, they may are prolonged, but sometimes they actually hasten death, whatever it may be. And you have to make those decisions. And so sometimes having it on paper and having that reminder of, what's happening right now isn't really meeting up with mom's goals and care. And I need to make sure that I bring in hospice. We, arrange our care to comfort care and really make sure that I honor what her wishes are, because she never wanted to be in a situation where, she couldn't eat her own food. She couldn't enjoy, her she couldn't enjoy her bread buns with butter and she's, being fed this pureed stuff, so I want to talk to the doctor and maybe see if I can just give her food that she likes, ice cream, things like that, even though it may cause aspiration, because she was really adamant that she doesn't want to be fed this pureed food. She wants real food, and that's important to her. And that might mean she might get pneumonia and die sooner, but as long as she's comfortable, she's okay with that. So this brings, as you can see, just in that one example, this brings out a whole slew of, other dialogues that we may need to have with our medical professionals that will impact medical decision making. But you absolutely must have these goals of care discussions, do these exercises for yourself or your loved ones, whatever it may be. Make sure you do it for yourself and make sure that your loved ones, your paperwork, all of this stuff really reflects it, and that your loved ones, your medical professionals understand all of this. So let me know if you have questions. Let me know if you've done this activity, and see what comes up for you. Is there something that's revealing for you? Is there something that was surprising for you? Let me know. Always want your feedback. Thank you so much for joining in. Let's continue these conversations and education about death and dying so we all die better at end of life. I'm Abigail. I will see you soon.